Hi, I'm Dr. Jabal Uffelman with Rejuvchip Testosterone Pellets. Today we're doing an insertion video to show how the pellet is inserted. Just to review, the benefits of testosterone pellets include increased mental energy, increased physical energy, increased sexual satisfaction, better exercise, better sleep, a whole array of benefits that are felt by both men and women. Okay, today we're going to do a female pellet insertion. We have our patient here lying on her right side. This is a good example of a patient that has a tattoo. So we're going to be hiding the small mark in her tattoo. This is something that is important because more and more people have tattoos these days, and we don't want to leave a scar on the body if we don't have to. Now, it's very small. We will use the same scar for future insertions so she doesn't have to accumulate more scars. But this way it's going to be hardly visible. So I've got the chlorhexidine swab prep here. I'm going to go ahead and swab the area. Okay, like so. In women, we put the pellets in the upper hip because that's where there's more sub-Q fat, and men, we put them in the flank or the love handle. So here I'm going to open the kit, sterilely packaged. Okay, it's got everything we need for the procedure. Here is my sterile pellet that comes separate. And here in the kit we have a little cup to place it into. I've already cleaned the top of the lidocaine with alcohol. Now I'm going to put my gloves on. So I've already prepped the patient. I've put the pellet into the kit sterilely. I've got my sterile gloves here. Okay, I'm going to point out all the individual components to the kit, the pellet insertion kit. As we see sterile gloves, we see a little cup for the pellet, scalpel, long needle for insertion of the sub-Q fat. This is the trocar system. Here's the syringe with a larger needle to draw up the lidocaine, which I'm going to do now. Okay. We have a 30 gauge needle we're going to use to inject into the patient on the first injection. Fenestrated drape. And then underneath we have steri strips, tegaderm, and some gauze pads. Okay, so let's draw up the lidocaine. This is a procedure you really don't have to have an assistant for. Draw up about 2 cc's for women. It's about 7 cc's for men. Okay, just shake that off a little bit. Take off the needle, place it here into the tray. Now I'm going to grab the 30 gauge needle. I take the sterile fenestrated drape, place it over the area. We're going to place the pellet right in the upper hip. Perfect. All right, now first I'm going to use my 30 gauge needle to make a wheel in the skin, okay, where I'm going to insert the pellet. Always brace my hands on the patient for stability. Tiny pinch, okay, withdraw. Slowly inject, forming a wheel on the skin. This is with the 30 gauge needle. Okay, now we're going to do further anesthetic with the longer needle that comes in the kit. This allows us to travel further into the sub-Q fat. So, bracing my hands, make a puncture into the wheel. Go about a ½ inch under the skin into the sub-Q fat, and then change directions. Okay, so now I'm heading in this direction. I'm going to withdraw on the plunger, make sure I'm not intravascular, slowly inject as I take the needle out. Okay, this should not be painful. And now to remember which direction I anesthetized, I am going to put a little drop here of just to discolor the paper, and I remember which direction to place the trocar. All right, so she's all numbed up. Take the small scalpel that comes in the kit and a small gauze pad. Okay, 3mm incision just adjacent to the tattoo into the numbed area. Okay, should not be painful. You have to eyeball the size of the incision. That is not quite big enough, so I'm going to extend it. And the way to extend it is to put the scalpel in and then slowly pull it out as you extend the incision. Use the tip of the scalpel. More control that way. So now we've got a perfect size incision. That takes practice. She's not bleeding, but I always like to keep a little gauze pad to apply pressure. Okay. Sharp tip trocar directly perpendicular under the skin until I feel like I'm in the sub-Q space. Now I'm going to change directions and go parallel to the skin in the direction of where I anesthetized, which I can see a little spot right here on the paper. Some pressure. We're in the subcu fat now. Okay. There we go. Sometimes a little loss of resistance with fibrotic tissue. Take out the sharp trocar. Have the pellet here. This is a 100 milligram pellet. This is a kit that is designed for 100 milligram pellet for women. Place it into the tube and then push it in with the blunt tip trocar. Perfect. So it's laying a few inches away from the incision in the subcu space. Okay. Okay, the pellet insertion is done. Now we just have to cover up the incision with steri strips. These kits come with steri strips. Sometimes they're short, sometimes they're long. In this case, it's a long steri strip, so I'm going to cut it to the desired length. It's not a big deal. Okay. And just like with any incision, you want to make sure you pull the skin edges so they're approximating perfectly when you lay down the steri strip. So this is done by doing some skin traction here and then eyeballing it halfway across the incision and then laying it down across the incision and then apply pressure. So this is certainly easy, but it's good to have proper technique that's consistent you do for every patient. So I laid the skin down, edges down perfectly, put 2 strips that way, 1 strip this way, and we're pretty much done. Now we just have to put the tegaderm on. This way the patient actually can take a shower tonight. She's got this tegaderm so the steri strips won't get wet, and she'll take the whole the tegaderm with the steri strips off in 4 days, and she start feeling her effects within 2 weeks. Okay, so I always tell the patient also to feel the tegaderm and the steri strip so they know what they're going to be peeling off, because it's not something foreign to them. And also if they're wearing tight jeans, I tell them to be careful not to peel their jeans off too forcefully, which can peel off the tegaderm. Okay, so that concludes the female pellet insertion. Thank you. Okay, now we're going to do the male testosterone pellet insertion. Slightly different from female. It's going to be more pellets, more passages with the trocar, different anatomical location. Instead of the hip, we're going to do it in the flank, or the love handle. This is less movement, less risk of extrusion in this area. So I've marked out the area where I'm going to have the tunnels of the pellets and the incision with a makeup crayon. It's not necessary to do that, but it's good for beginners. Okay, now I just cleaned up with the chlorhexidine swab stick that comes with the kit. Now I walk over to the kit. I've already got my pellets sterilely placed into the cup, and I'm going to sterilely place my gloves on. So a male pellet insertion requires more anesthetic, about 7 cc's instead of about 2 cc's for a female. I use 2% lidocaine with epinephrine. Here in the kit I've got a nice 10 cc syringe with an 18 gauge needle to draw up the lidocaine. This is a procedure you don't really need an assistant for. Okay. Alright, got my 7 cc's. Now I change my needle to a 30 gauge so I can inject. And I'm also going to grab the fenestrated drape, which has sticky sides, so it'll go on the patient, keeping the sterile field. Here we go. Now the patient's going to feel a slight pinprick, and after that you shouldn't feel anything else. I'm going to go adjacent to the makeup mark, let tiny pinch, inject almost a cc in this area and creating a wheel. It's going to burn a little bit, sorry about that. Okay. Okay, now we're done with the 30 gauge. Take that off. And now we have a slightly longer needle to inject further into the subcu space where the pellets will be passed. Okay, I always brace, any procedure you want to brace your hand onto the patient as much as possible so you're not shaking. So I'm bracing my needle, go perpendicular into the subcu space. Okay, and I'm going to do my first tunnel, aspirate, make sure I'm not intravascular, inject approximately a cc on my way out. Okay. Don't leave the skin, change directions. Got my other mark here, injecting on the way out. You okay? Perfect, no pain. Slow injection. And then a third tunnel this way. And each tunnel should be about maybe 30 degrees apart from each other, 20, 30 degrees. The important thing is the pellets are deep into the subcu space. Another trick so you remember where you actually did the injections is to do a little of the lidocaine in each little spot so you remember where where to pass the trocar. Okay, we got the pellets ready. We have our scalpel. Let's go ahead and set up the trocar. Sharp obturator goes into the trocar, ready for insertion. Always have a gauze with me to apply pressure, to soak up any anesthetic. Put a little tension on the skin, make a 4mm incision in a transverse fashion. That way the scar, less likely to form a scar with the lines of Langerhans that we learn about in surgery. Okay, we can eyeball the size of it. That looks about right. A little bleeding is normal, so we apply pressure. Okay. Sometimes you'll make the skin incision a little too tight and you'll have to go back and make it a little bigger, but we don't want to make it any bigger than necessary. Okay, a little pressure. So once you're under the skin, which I am now, I can change directions and go parallel to the skin, of course. A little pressure. Okay. No need for big or fast movements. Everything's very deliberate. Pull out the sharp trocar. Okay, now I have my sterile little pellet holder here. I'm going to load in two 200mg pellets. Okay. Take my flat-tipped obturator, push it in. Sometimes a little discomfort as they're getting pushed distally to the anesthetized area. Okay, now I'm going to go ahead and pull out a little bit, change trocars again. Okay, now our next task is to form a new tunnel. So we're going to pull out almost to the level of the skin, change directions, and just nice and slow. We've already anesthetized the area, so it should not be painful. Remove the sharp obturator. And again, place 2 more pellets. All right, we're almost done. Push these in. See, there's just, on a man, there's much more sub-Q fat to work with here than in the butt, or the upper buttock. Okay, place the sharp one in, redirect again. Do not remove the trocar from the skin. And then down here. Should not be much bleeding. Usually a pressure dressing is plenty. Some practitioners decide to place a stitch instead of steri-strips, but usually a steri-strip is sufficient. Okay, we're now pushing in the last 2 pellets. Perfect. Now I'm going to remove the obturator and apply pressure. As I take the steri-strips off of the paper, I'm always applying pressure. Okay, lay it down here. I'm going to take the skin and pull it on stretch like that. Lay it flat and then do a series of tandem steri-strips, one after the other. We'll do like 3 this way and then a couple crisscross. All right, perfect. Now in the kit we also have a tegaderm, which is going to cover the steri-strips and make so the patient can take a shower and not worry about them getting wet, peeling off. Always hold pressure for a few seconds. And if it looks like there's any bleeding, we'll put a pressure dressing on. Typically in men we do use a pressure dressing because it's more of a traumatic placement. In women, with just a single passage of 1 pellet, it's rarely necessary to use a pressure dressing. And that's it. Thank you.